you for asking me to be part of the talks. It's something I'm very passionate about. I know it's an ongoing debate, but it's something that I feel very strong about. And so I was more than happy when they were asking in health services which one of us would like to come speak. So just to kind of get you started on just Influenza 101. So what is influenza? A lot of people get it confused with the stomach bug, and that actually is incorrect. Influenza has nothing to do, per se, directly with the stomach. You may have some side effects from either medication, drainage, what have you, that can make you nauseated, but it's a separate virus itself. Influenza is actually a virus that affects the respiratory system. It is spread through respiratory droplets, whether it be coughing, sneezing, talking, and droplets come out. So believe it or not, how we really stress good universal precautions, that's the reason why. Because if you see there, it can survive on a surface for 24 hours. So say if I was infected with it, I coughed, I touched something, door handle, computer, you name it, and it was not cleaned properly, that's grounds. You would go to touch it, you covered yours, cough, that's what it can take to get it.
Is it okay to ask questions while you're, I'm sorry.
I don't know what, it doesn't matter,
It's up
go
to
right
you.
ahead.
I don't want to interrupt, but
Yeah.
I'm confused, like if this is this not infinitesimal, but this tiny little virus that can survive on surfaces for 24 hours, why does it die on tissue after 15 minutes? What's the difference?
That's a good question, and I didn't look that up. There's a lot I was actually wanting to look up to see what the difference of it was, to see. But I know when I did do the research on some of it, it was based on oxygenation. A lot of things, what we have on our body, kill it off. It doesn't give it prime host environment. I'll get into in a minute why people say that the immunization makes them sick. It really doesn't. That's incorrect, and I got that. And so I would guess the same reason with why I'm going to explain that is because of just our body's temperature and so forth. It really needs a cold environment to grow and produce then in the body.
I could throw in a clarification. They mean human tissue, not Kleenex tissue.
Okay.
I
That
think
makes
that's
sense.
it.
Yeah, I'm sorry, I misinterpreted.
Oh, I'm sorry. Yeah, human tissue.
Yeah.
Yeah.
That is a
Sorry,
good
yeah.
question because I wondered that myself as far as, what's the difference. But I think it's just your environment, acidity, pH, anything like that can affect it.
My memory's a bit sketchy on which species, but the infection control person, Ramona, she touched on it, and it was something to do with the bacteria in the skin and the
That's on
pH.
there.
Yeah,
And I
the
looked at
multiple
the word
hand
was
washing
that.
would strip it and reduce the
The transport, absolutely. And that also being said, there's different strains of it. As you may have heard, you hear a lot A and B. Those are the two primary types of influenza that are present. However, there is an influenza C and a D. However, C you really don't hear much of, which actually most people probably do have, but it's not tested. I've been a nurse for 20 some years, a nurse practitioner for almost 12. Never do I remember ever testing for C. I think the symptoms are so minute that it's just considered like a common cold. So that's what that's treated like. So if it were to be actually tested and seen, you probably would find the virus responsible for that. Influenza D affects cattle, and to the research that I have looked into, it's never been known to be contracted through a human. So back to the A and B. Influenza A has two subtypes, and you may have heard of one specifically, H1N1. H1N1 was huge. The first year I got out of RN school, or nurse practitioner school, and it was the biggest epidemic within 40 years. And I even had a not one of my patients, but I had a patient that it's crazy how you can look back and think on things. And it was within my first 6 months of practicing, and she was crying when I went into the room, and it was something she shouldn't have been crying about. And so I asked her if she was okay, and she had said her cousin, who was pregnant, had just passed away from H1N1, and the baby survived. She was pregnant, and the baby survived, and the mom had passed away from it. And so it's just one of those things that stick in your head. And so you hear a lot about that one. The other one is the H3N2. And then with influenza B, there are no subtypes, just lineages of where they come from. They both can be present. I've had patients that is infected with influenza A strain, and then 2 months later, they come back in, you test them again, and they have B because it's a different strain. So just because there's one doesn't mean you won't get the other. You can get them both. Symptoms are all still about the same. You're going to have your runny nose, your cough, your high fevers, your body aches. It's just a different strain. And how they're named is just in regards to the antigen, the host, the geographical area, the strain number, and then the year of isolation. So that's all big numbers, what they come down to. So, comes into my biggest part of this presentation, how do we stop from contracting influenza? Well, there's no 100% way to get rid or make sure you don't get influenza, but the best chance is to be immunized. It varies anywhere from 40 to 60%. And last year, the CDC, which is the only true organization that really follows and tracks the statistics. And even with adults, it's not mandated if there are any deaths in the hospital that they have to be reported through as an influenza cause of death. However, children are mandated. So they have more statistics on children with influenza, but they are getting better in tracking all, so they can get a better, get more research, because they research this year round. It's just not a month before the influenza season hits that they're like, oh, let's just throw together some of the viruses to see which ones are the prevalent ones right now. The CDC, they have a special group of infection control. They are working year-round to research, do statistics, find which areas are more prevalent, find which strains are more prevalent. They meet with other countries twice a year to see what areas and what strains that they're coming in to contact with. So it's a year-round project that they focus on. And there are two different types of vaccines that you can get. One is the trivalent, which has 3 components in it. And when it has the components, it means, is it going to be against the H1N1, H3N2, 1 or 2 of the B viruses, or is it the quadrivalent? I will tell you most, because I was like, when I first started seeing those, I was like, well, wouldn't it make sense just to use the quadrivalent, because that's 4 strains. And if you look in them, look through them, and it comes down, it comes down to manufacturer. You hear of Bayer, you hear of Pasteur, there's just different companies, and they all have theirs, just like any other immunization. So it really just depends, but looking through them, most all of them now cover the 4 strains. Why wouldn't they cover some over another? Again, the newer vaccine. There are some that are made that are for higher dose, which our elderly need a little bit higher booster, because they're going to be the ones who are more susceptible to coming down with the influenza, and as well as immunocompromised and little ones. And I'll get to that also in a second. So how does it work? Well, if you've ever had an influenza vaccine, one of the questions they ask is, do you have an egg allergy? And the reason they ask that is because, not that there's egg in the vaccine per se, but the virus is grown in laboratories in eggs. And what they do is they, after it's grown in the egg, they suck the virus out and they wash it down, which doesn't per se the virus. So it's an inactive virus, and so then they make it into the laboratory, into the immunization. It's given into the arm, and your body then produces antibodies which will fight off toward that virus when and if you're in contact with it during the flu season. So this is just kind of showing after you get the shot, you see all the little protectants come up, those are your antibodies, and they're trying to block the virus from coming into your body, which helps protect you. So you think, okay, well, if I get a flu shot, why do I got to get one every year? I got one last year. Well, it changes every year. When I say it changes, the virus changes. It all goes, and we could be here all day long. I could go back to my chemistry days, which I'd rather not do and relive that. But it goes down to it replicating and mutating and taking different paths to where more, when it started, and we'll get to that one too, it was easy. It was one strain, and you got one shot. Then it replicated. And I'll come to that right here. It's kind of hard to see, and I apologize. So starting out with influenza, and I believe that they had mentioned that about the 1918 influenza, the Spanish influenza. It started out, I don't want to say simple, but one strain. And then as you see, when you get to 1957, it's replicated, it's changed its DNA, it's going to be harder to protect against. And that's when H2N2 came, or the Asian flu. Then as you see again, more changes, it changes its structure. And that's when H3N2 came on, another strain once again. Then with the multiple you see, that's H1N1 from 2009, when it really impacted, and a lot of people were sick. You know, it was a national epidemic. So what does that mean? That's what's a little concerning for the scientists and researchers. If it keeps mutating and changing, what's it eventually going to be? They say it could become so used to it that the symptoms would be nothing more than another cold. So that would be nice, but it also could become more virulent to where it's going to be harder to treat, and the symptoms will be much more severe. And so that's why they work year round, to try to stay on top of it and find ways and do the research in which direction it's going. So you may hear, and I hear all the time, and I get asked all the time, and I get into conversations, but don't go on false information. And as I said, the main information that's out there is going to be from the CDC and the National Institute with Infectious Disease and the World Health Organization. They're the main ones who take the information and the research. I've read several articles, and it may say it was from Dr. So-and-so or this, and again, it's personal opinions on that. So, you know, not everything's 100%, but the information that is out there, that's what I would recommend going off of. So reasons that they say they don't get it is, I get sick when I get the vaccine. So as you were kind of asking earlier about the tissue, this is where I say it came in. Actually, that's incorrect as far as you can get sick from the flu vaccine. I've had family members tell me they won't get it because they get sick, and they can't. It's inactivated. It's not a live virus, so it can't go in you and then you get sick the next day. And It also then is derived, if it is even just a weak virus, it's still there when they pull that out of that egg. It's actually from the proteins of the virus, so it's not the actual virus. Now, a recumbent vaccine means it's a little live virus, and again, why would you get that? Depending on what dose you need, if you're that higher dose, what have you. But again, it's usually so weakened it can't. And for the other reason, it's cold adapted. Only it can cause the infection in cooler temperatures. Our body's 98.9. So in order for that to sit there and live, by the time it would get to our respiratory system and our lungs, it wouldn't survive. So therefore, you cannot be infected. Now, with that being said, as you know, I talked about the influenza C a while ago. Could it cause a small amount with the C and you get the runny nose and get a little body ache and so forth? Yes, but it's not the actual influenza virus that everyone thinks they're infected with. The other excuse is I have an allergy to eggs. Now, this used to be true because of the way they did make the virus, or the vaccine from the virus with the egg. But since then, they've learned, again, with research, that's why they researched this, to make things better. And they've realized that, okay, we inject or take out the protein and then they rinse through and inactivate it. So now actually people with egg allergies can receive any licensed age-appropriate vaccine. And when I say age-appropriate, any child over the age of 6 months to elderly is recommended. And there's a standard dose that everyone gets, or there are the high dose for the elderly. One thing other I didn't talk about on the last slide was the types of the mode of transmission, mode to have the immunization. There's also, it was called flu mist. It's still out. It used to be pushed a lot, but because it's more of that recumbent virus, it's more of the live one, and so that was more of a vehicle to possibly get some of the side effects. So the office I used to work with, fabulous physicians. I worked with internal medicine, pediatrics, and they really used to push the flu mist, but because they've improved with the vaccines, they now tend to push the vaccines over the flu mist. And then the ever so, I've been vaccinated and I've never been sick with the influenza. And there is a reason for that too that people really don't take into consideration. And it's called herd immunity, which means if all of us in this room have been vaccinated except one, you're not going to get it because we are all protected. So we have a decreased chance of being infected. So therefore, you're going to be covered with the help of us. Same thing. You think about the university. For the majority, most people are going to say, I don't get it. But you get somewhere like a university where you have that frame of mind that I don't have to be because I've never been sick. Well, think how many other people have that same mentality. Now you are all, and instead of the people being vaccinated, think of the ones not vaccinated on there. That's when your outbreaks, it doesn't matter if it's influenza, if it's meningitis, if whatever it is, it's the more people that's protected against it with immunizations, the more everyone's going to benefit from it. So what is the purpose then of the vaccine? I've said that it only helped with 40% last year, and the overall is 40 to 60%. Well, I'm not a gambler. My mom tends to like her slot machines, and like I told her, my mom was recently diagnosed with COPD last year. So if she were to get sick, it could really affect her because it's a lung disease. She already has problems breathing. So like I told her the odds wouldn't you rather have a 40% chance of not getting it because you got an immunization versus 0% for not even getting the vaccine? Because it all comes down to them trying to research on what strain is going to be prevalent through the year. So they're trying to improve it year after year. Yes.
So if you get a vaccine, if you get vaccinated, you're 40 to 60% likely to not to get
Correct.
influenza.
Correct.
But there's still, it could be 40 to 60% that you could get.
Exactly.
But if you don't get the vaccination,
You're safe. Unless there's herd immunity.
you will get it other than herd immunity.
Likely, if you get it, the more prevalent it is.
Is there? I mean, so I guess the chance of getting it is really dependent on where you happen to be and if there's an outbreak in that area. Right?
Exactly. And that's why they stress healthcare so much. We're the front line of anyone being sick. And you could come to the clinic for a well visit. You just need a physical for whatever, a work physical. Well, you come in during the time it's prime sick season. You have all these people with influenza. I would rather have a shot and take my chance of having 40% coverage versus nothing at all. I mean, it's better than nothing. And like I said, they're researching all the time to make them better and better. And it comes down, they don't know from year to year. They can't predict what strains. They only know after the flu season is over. That's when they start collecting their data. Okay, how many was hospitalized? How many deaths were there? Then they bank on that for the next year, how to make things better. So it reduces illnesses altogether. You see a lot of, like I said, the influenza deaths. That's because if you are an infant, you may not have the immune system built up to fight against the influenza virus that others have. My little niece was born without an immune system. She goes every week to Children's Hospital and gets infusions to take the place of her immune system because she can't fight it off. So again, I'll take my 40% chance of not getting her sick because I would feel terrible knowing that I could have gotten a flu vaccine and taken the 0 versus 40% chance to help protect her. Older adults especially, most of them, again, COPD, they may have history of pneumonia, which can worsen once the virus hits them, diabetics, there's just so many other comorbidities that could play on top, and then once the influenza infects, it just can double whammy with them.
So 2 people get the exact same strain of influenza. The likelihood of death is entirely dependent on the strength of person A's immune system.
A lot of the factors, because my mom and I, for instance, I'm as healthy as can be. I have no medical history, or I take that back. There's an age difference, so to make it more equal, my friend, she's diabetic, type 1 diabetic, juvenile, had it since she was little. I'm completely healthy as can be. We're given the same vaccine. She's likely going to be way more susceptible to still getting it because her immune system isn't the same. It's not going to fight off. It's not as strong. So it really plays a part in age, in your comorbidities that you have. Pregnant women, as I was saying, the lady that had been pregnant and passed and still delivered the baby, a lot of people, was the baby infected? They can, but it's also good to have the vaccine because, as you've seen, I said the age is 6 months and older, so that baby wouldn't be able to get the vaccine, but because of mom, it does cross and baby does get some of the antibodies to help fight that off. So it's very good for mom and for the unborn baby to be immunized with it. So there are the 2017-2018 results according to the CDC. Again, it was one of the highest severity seasons since the 2009 H1N1 pandemic. Both A and B was seen, and I can attest to this. And I worked at a very busy urgent care clinic where we would see 90 patients a day just walk in. And at the beginning of the flu season, which I would say from end of October to January, almost all was influenza type A. Same symptoms, always coming in. And then seeing more through March to May, that's when we started seeing more of the B. And that's when I said we had people that was A, they thought they were through, had it, come back in, nope, they had B because it was a different strain. So, and a lot of people say, well, it's only 40% effective. So a lot of people think of the US total in general, and well, only 40% of people, no, that's your percent. So my percent of not getting it would be 40%, 60%. So yeah, you could say it's half-half depending on the year or what have you. But again, I would rather take the chance of not than having it. So and those who were hospitalized, according to the results that they had, because they are starting to record more so they can get more information to better the vaccination. 59% less ICU admittance than those who were not vaccinated. So I think that's a pretty good percent. And those that were in the ICU and were vaccinated were out of the hospital 4 days less, which if you've ever been in the hospital, that cost adds up. So not only are they feeling better and doing better, and now, again, cost is huge too. And children's deaths, again, the only ones that are reported. Last year, deaths were up, exceeding previous high numbers of 171. That was, 6 years ago? About 6 years ago. So 179 reported deaths attributed to influenza actually causing it.
Do you know why adult deaths are not reported as being attributed to influenza?
Well, I read on that, because I was wondering the same thing, is because they said a lot of times the report of death may have been pneumonia, but yet the reason they got the pneumonia was because they were positive with the influenza. So it gets hard to decipher what actually brought them in, but they are starting to document that more. That way they can get a better number on it. And I thought that number was alarming as far as of the 179 deaths that were reported due to the influenza last year, 80% had not been immunized. That's a pretty good number. So what does that mean for this year? Last year, it was an approximately estimated of 155.3 million doses of influenza vaccine. This year, they are predicting 163 to 168 million doses, both of the inactivated and the recombinant, so the 3 versus the 4 strain. Will it be a good match? Like I said, unable to tell. They just try their best to take the information and research they have throughout the year and hope to improve it every year. So is the flu vaccine still recommended then? Absolutely. Again, it comes down to, are you a gambler or are you not? I would rather have 40% chance knowing that, yes, I will be covered over it. So it comes down to vaccinating your crew, family, friends, roommates, classmates, because it's out there, it spreads fast. We're already seeing tons of illnesses, especially within, with the college. There's not been any reported influenza yet. I'm waiting. I was thinking I had my first one yesterday because the symptoms were right on, but they were negative, so it's just a matter of time. I have heard, whether it was out of Sarah Bush, I'm not sure, but there have been already some positive cases that are documented. So whether or not it's to help protect you, protect loved ones, I
Do school nurses have their test? Do they report?
Do they test in
I mean, that
schools?
seems like a frontline place, like, if a kid comes in sick and the school nurse.
They send them to they don't test them at schools.
So they send them to the vet.
They recommend them going to the physician. And it really, I know there's guidelines and so forth, but it really depends on school to school. I worked in different school districts. Some are more lax and laid back. I've had some, if the student has a 99 temp, they're calling parents to come get them. Yeah, I think it's strep. I think it's influenza. You need to take them. I've had some that'll say no until it's over 100. They're okay. But for the most part, all of them, the nurses will recommend you need to go be seen. They're demonstrating signs of influenza, or they're showing signs of strep. So to actually test in the setting, no, they don't. So any other questions?
I know you talked about how different strains develop as the flu virus gets smarter and creates a new one. But I'm just curious, have we ever eradicated any of them? So like the virus from 1918, is it still out there?
It's still there.
We never actually
They may
killed any of them.
Mm-hmm.
We just keep getting more versions of it.
Right. That's exactly right. It weakens, but then that's how it changes that and makes it more challenging and difficult for them to keep coming up with different vaccines for them. Yes.
Do you know what the usual vaccination rate is for Eastern? Like what percentage of people
I
usually
don't, and I would like to. I think people are documenting more. I mean, it's always documented, but I think the research of actually getting the percents down and knowing, yeah, only 20% of students actually get vaccinated. And I was actually wondering that today because they have the clinics coming up, and I wondered how many took part in that. And actually, they're free. You know, where used to not be the case, and so a lot of people didn't have insurance and good immunization coverage, so cost used to be a factor in why they would get one too, which now, since it's really favored upon getting one, insurances are covering, there's free clinics, and so there's no reason not to take advantage of it. But that is something I do want to find out, because I've been wondering as well.
I think the flu clinic, for those who may not know, is Tuesday, right?
Tuesday, yep.
A week from today.
Mm-hmm.
I want to say 10 to 3, but I could be, actually it's on the postcard. It's 10 to 4, 10 to 4, is that what it says on there? So free for students, faculty, and staff at the Union next Tuesday, 10 to 4.
And they usually have
Take
cool
advantage.
buttons that you can wear that say I got vaccinated or whatever. So
You said there's a nasal spray and a shot. The nasal spray seems less, I prefer that shot. Why would I choose the shot?
Because that is the one that has the recombinant in it, so it's weakened, it's not completely inactivated. So I think it has a few more side effects. I don't want to say, yeah, it is side effects because it's not the virus that you get from it, but it's a weakened state. So you could get like the influenza C per se, where you are going to get a little of the body aches and the runny nose and the cough, but it's still not per se. If you were tested, it would not come up influenza A or B.
And it's more effective as prevention than nasal spray.
What I've read up on, they end up still being the same. Now, when my son was little, because he was little and I didn't want to put him through getting a shot and being hurt, he got the flu mist. But then that's when the office he was at, where I worked, the pediatrician kind of veered and started doing the actual vaccination instead of the flu mist, to which they inhale.
I'd like to thank everybody for coming in today. We will get this recorded and put up on the library's YouTube channel, so if there's anything that you wanted to review, it should be up within the next couple days. Thank you again for taking the time to come over to us.